Hi, I'm Thomas, the CNA Ninja, and the other ninja's sitting over there on the couch over there, hoping she don't bark. But anyways, I'm going to talk to you guys about postmortem care on a patient, and a lot of times you'll have more than the rest just because of where you work at, whether it's like, say it's at a rest home, of course for older people, so you you get a lot, a lot of people that will pass. Um, I've done a few of them, so I'm used to it. A lot of people are a little bit afraid of it and stuff, but if they are and you want to take over, just let them work with you, and it's okay to be a little afraid or whatever. But the first thing you want to do is take the if it's in a room with two patients, you want to take the other patient out, put them in another room for now. Also, you want to after you do that, of course, you want to try to make sure that right after either someone finds that they don't have a pulse or whatever, that you try to make sure that their eyes and their mouth is closed. If not, you can either hold it or get a towel or something that you can hold it shut. And because if you wait too long, it's not going to close. And it's just better if it's shut all the way around. Anyway, so after you do that, you want to give the patient a bed bath real quick, just something, you don't want any odor, you don't want any blood, any secretions, anything on them. You just want to give them a quick bed bath. If they got any clothes and you want to dress them in their pajamas and stuff, or else a gown, make sure the sheets are changed and the pillowcases are clean. Just put new ones on, whether they're clean or not. Just get a new one, put the pillowcases on, get a new sheet, change the patient after you give them a bed bath, and rub some lotion on them so they don't have any odor. Uh, After the bed bath, of course, dry them up real good, comb their hair, um, just everything like if they were still alive. Um, and be gentle, it's still somebody's loved one. And just because they passed doesn't mean that you don't need to give them respect and dignity. And then shut the curtain. Make sure that the curtain is shut all the time, and um, that when you're in there, that just let people know what you're doing in there. Also, after you give them the bed bath, lotion, comb their hair, get a new brief on them. Absolutely, put a new brief on them, and also you want to, like I said, put a new gown, get them all ready, and clean up. Take all the trash out and all the linen, and you want to make sure that before the family or when the family shows up, you can go to the dining room and get a compassion card, and it should have like drinks and snacks and stuff and water for the loved ones that are going to come in and visit their loved one before the coroner shows up and picks the body up. Also, just pop in and out and make sure everyone's okay. If they need anything. Just be as quiet as possible. They're going to be there for a couple hours or whatever, how long it takes for them to say goodbye, and then the coroner will show up, and then they'll take the body. But like I said, if someone's afraid, just help them out. Just kind of walk them through it, and try to make them feel easy at it, and just take some of their fears away. The younger ones are the ones that are a little bit afraid. Um, I've, I've done, a few, but the first one I was afraid too. I didn't know what to do or what to expect, or my feelings were mixed, and I was a little afraid. But after you do one or two, it never gets easy, but when you know you're doing this for someone's loved one, and that that it's gonna help them with the grieving process and everything if their loved one looks presentable. Um, and usually they're pretty nice. Just take them water, like I said, and just always praise them and just give them their time. You don't have to keep bugging them. Just make sure that they got water and juice and stuff like that, and just make sure that the room's ready again, and that you can get the cart early and set it in there so it looks presentable and stuff, and make sure there's some tissue in there. There's probably some from the patient, but take another box in there, just to have, for the loved ones. And with that being said, you guys all have a great day, and like, subscribe on the video, and please, so I can help make this channel grow. And that's it. Have a great day.